Kemmanu can come up now. We're going straight to the next presentation.
I'm Dr. Vasudha, and I will be making a presentation on ocular morbidity, visual impairment, and its association with social factors in children attending primary health services in Pavagada in India. So, these are the sources of funding, and there is no conflict of interest. So, primary eye health care in India has a huge potential for improvement. And improving primary eye health care helps in universal coverage of eye health and helps in implementing integrated people-centered eye care, and thus also reducing the burden on the overloaded secondary and tertiary facilities. However, there are no studies that have been done that in public-run primary health centers estimating the ocular morbidity, and this is very important in taking appropriate measures for service delivery. So the study location, this is, we have taken 2 primary health centers in Pavagada, which is in Tumkur district. This is the Karnataka state and this is India. It is a health facility-based cross-sectional study which was conducted in July-August of 2023. The main aim was to estimate the prevalence and causes of ocular morbidity and visual impairment in patients less than 18 years of age. They attended these 2 primary health centers for any reason, like it could be fever, diarrhea, or anything. And we also tried to associate this blindness and visual impairment with the social factors. So when a patient entered the primary health center, the registration was done by the PHC staff only. Consent was taken by a trained nurse, and the questionnaire containing demographic data and the history was taken by the ophthalmic technician. And the same ophthalmic technician, we had 2 of them. So the same person also took did the vision screening. Visual acuity was done. Red reflex was done using the direct ophthalmoscope, and an external examination was done using the torchlight. And any child who had a visual acuity of less than 6/9, an abnormal red reflex, had an history of eye surgery or was wearing glasses, and on external examination, if any abnormality was found, they were referred to the base hospital, and there the pediatric ophthalmologist examined the patient and treated them. So, main thing, totally, this is not the new one that I've sent. This is the old. So this will take me 12 minutes. So we screened 965 patients and we referred 125. Out of that, 72 came, and the referral rate was less. That is just around 58% came, 42% dropout. So the refractive total ocular morbidity was 8.6%. And refractive errors were the main cause of ocular morbidity, and in that astigmatism was the main cause. And there were about 3% who were blind, and 14% had mild to moderate visual impairment. And 54% required some form of treatment. What I want to emphasize is that in the treatment, most of them, that is 77% of them, could have been treated in the primary health center itself. And only 23% actually required the services of a pediatric ophthalmologist. And when we came to the social factors, we found that children of parents who had no formal education and who were the children of housewives and those belonging to middle and lower middle class had more visual impairment. So actually, main thing is, why was there a 42% dropout. This one is something that we really need to think of, and we feel that it is because of the parental inability to detect that the child has a problem. This it is consistent with the previous study that was done in that area. And again, unmet need. I just want to talk about this. There is about 54% unmet need. And as I told you, 77% could have been treated but was not treated because there is a paramedical ophthalmic assistant and there is a medical officer there. The paramedical ophthalmic assistant does not have a retinoscope, and he does his refractions on a trial and error basis. So you can think what kind of glasses can be given to a child. I think all of them will end up with myopia. So no infrastructure, proper infrastructure, and human resources also are very less in the PHCs. So social factors, actually the numbers are too less to comment. But as I told you, we found that association that lower middle class, non-agricultural laborers, and illiterate or formal education, without formal education, they had a more major problem. So the lack of staff, we had this problem, lack of staff to do the screening. So we overcame this by using these diploma in ophthalmic technology students to do the screening. But the problem was they were posted there only 2 weeks. They are students, they are posted in that base hospital for 2 weeks. Our study was 1 month, so I was able to retrain them. But there is difficulty in maintaining this team continuity. And the main problem I feel is that low patient turnout. That is one huge problem that we always have. Low referral follow-up rate, because there is even parental resistance. And this we tried to overcome by doing repeated phone calls. And sometimes the entire PO team went to the PHC. And sometimes we try to arrange transport to bring them from the PHC to the base hospital. And then some of them came to us. They had their referral slip missing.
1 minute.
This was a small thing, so we could manage to do. But if we could digitalize the data, I think that would be helpful. We could give the send SMS over the phone. So what we thought was, if we have to prevent this referral low uptake, so maybe we can station a mobile eye clinic there, and we could see the patients then and there. Instead of calling them to come to the base hospital, see them then and there, treat them and send them. At least the first follow-up thing will be solved. And what did we do to translate the evidence? I feel the first and foremost thing that we should do is try to publish our results, because then it helps in dissemination and it helps, it becomes more authentic, because publishing is a peer review process and it is easier, I think, to convince the government. I'm thinking so, I don't know. And we are trying to do a project now to train primary health workers in early detection of eye diseases, and we are hoping that result in early referral. So in conclusion, I want to say that 54% unmet need represents a significant gap, and if we can train the PMOA and the medical officer to look after the 77% who come there, then it is really going to help unburden the secondary and tertiary care. Thank you.
Request Mr. Saksham. Yeah. Thank you so much.